Welcome back to Mind Health and You. Today we're exploring a fascinating and sometimes unsettling topic, trypophobia. Have you ever felt uncomfortable or even disgusted by clusters of tiny holes, like a lotus seed pod or a honeycomb? If yes, you're not alone. But here's the real question. How common is trypophobia? And is there actually a test for it? Let's find out. What is trypophobia? Trypophobia is the strong feeling of discomfort, disgust, or even fear when looking at clusters of small holes or bumps. Think about patterns in sponges, strawberries, honeycombs, or even certain skin conditions. These images can trigger reactions like goosebumps, nausea, or itching. Interestingly, trypophobia isn't officially recognized as a mental disorder in the DSM-5. Some researchers see it more as a disgust response than a fear. But for people who have it, the reaction is very real and often very intense. How common is trypophobia? So how many people actually experience trypophobia? Studies suggest it's more common than most of us realize. In fact, researchers believe up to 15% of people may have some level of trypophobia reaction. Some studies even suggest that women are more likely to experience it than men. It often shows up in childhood or teenage years, though some people only notice it later in life. But why is it so common? Scientists think our brains may link hole clusters with danger. For example, poisonous animals like snakes, spiders, or certain frogs often have patterns that resemble clusters of bumps or holes. Our survival instincts may be hardwired to feel uneasy when we see similar shapes. So even though trypophobia isn't officially listed as a disorder, it could be part of our natural biology. Is there a test for trypophobia? Now let's talk about testing. Currently, there is no official medical test for trypophobia. However, researchers use something called the Trypophobia questionnaire. This test asks people how strongly they react to certain images of holes, bumps, and clusters. Participants report their level of disgust, fear, or discomfort. The results give scientists a way to measure trypophobia sensitivity. There are also online versions where you can look at pictures, like lotus seed pods or bubble clusters, and rate your reaction. While these aren't clinical tools, they give people an idea of how strongly they might experience trypophobia. But remember, there's no blood test or brain scan. It's all based on your personal reaction. Coping and treatment. So what if you realize you have trypophobia? The good news is, you're not alone, and it can be managed. Here are a few approaches. Avoidance. Some people simply stay away from triggering images. Exposure therapy. Gradually looking at less intense hole patterns to reduce the reaction over time. Relaxation techniques. Deep breathing, mindfulness, or grounding exercises can help calm the body's response. Cognitive behavioral therapy, talking with a therapist to reframe the thoughts and reactions linked to triggers. And since trypophobia isn't officially classified as a disorder, treatment usually focuses on reducing discomfort rather than curing it. So, let's recap. Trypophobia is more common than you might think, affecting up to 15% of people. While there isn't an official test, questionnaires and image-based surveys help measure it. And if it bothers you, there are simple ways to cope and reduce the discomfort. Do you experience trypophobia? Let us know in the comments below. Your story might help others feel less alone. Thanks for watching Mind, Health, and You. Don't forget to like, subscribe, and share this video if you found it helpful. See you next time with more insights into mental health and the human mind.